Western Mass communities will be part of an $89 million research study to look at the best way to reduce opioid deaths. The study will be led by Boston Medical Center, and the towns of Greenfield, Athol, Montague, Orange, and Pittsfield will be among 16 Massachusetts towns participating in the study. Carolee McGrath sat down with Debra McLaughlin, the coordinator of the Opioid Task Force of Franklin County and the North Quabbin region, Jennifer Kimball, coordinator of the Berkshire Opioid Addiction Prevention Collaborative, and Dr. Peter Friedmann, Chief Research Officer at Baystate Health, to find out more.
This project is being led by Dr. Jeffrey Salmon at Boston Medical Center, and it's a substantial effort by the federal NIH, from the National Institutes of Health, to try to reduce opioid overdoses by 40% and to determine what community-based interventions work to achieve that goal.
So that is a pretty aggressive goal. Obviously, for the families who are dealing with that, they would say absolutely, but that's quite a goal within that 4-year study.
It's very ambitious, both the goal and the scope of the project. There are 4 states that have received these grants. Massachusetts, of course, is one. Our neighbor to the west, New York State, received the grant as well. Ohio and Kentucky, also states that have been hard hit by the overdose crisis.
Okay, and how will the study be structured? What will you be looking at as you try to achieve that?
Yeah, so NIH really wants the best possible evidence to show what will work in communities, because these interventions are necessarily both expensive and difficult to implement. So what they have proposed is to actually randomize communities. They're going to do a matching process looking at characteristics of the communities to sort of pick ones that are sort of similar, and then they're going to divide them randomly, like a flip of a coin, some to get a comprehensive intervention for 2 years, and some not, and then they're going to sort of look at what happens with the overdose rates. And then for ethical reasons, after 2 years, the communities that went to the control group that did not get the intervention, they will also get the intervention.
And some of this will include like a medical treatment for those who are suffering from a substance abuse disorder?
Yes, so Massachusetts really has been at the forefront of encouraging medical practices, primary care practices, emergency departments, and others to work to initiate medication treatment for opiate use disorder. Medication treatment is one of the evidence-based practices that they will be looking at in the project, and Massachusetts, what they call the Massachusetts model, actually will provide nursing and other staff to help community practices really engage these patients.
Debra, tell us a little bit about Franklin County, the towns that are going to be involved in the study, and what you've seen in your experience in the last several years with this issue.
Sure, I'd be happy to. Franklin County in the North Quabbin region is a 30-town community, really, that spans nearly 1,000 square miles. So we have a lot of rural diversity within that those confines. And we're finding that despite all of our intensive efforts to really address the opioid crisis through a series of prevention, intervention, treatment, and recovery options, that we had a record number of overdose fatalities in 2018 compared to the year before. So largely this was attributed to fentanyl. Like 89% of the cases, fentanyl was detected. So we're trying to examine, with the help of this grant and working with our partners in Berkshire County and other communities that are involved in this, we have 4 sites, Athol, Orange in the North Quabbin region, and we have Greenfield and Montague in the north central part of Franklin County. So we're eager to learn more about what will work, particularly in a rural setting, to address this crisis, particularly since we have a lot of treatment deserts right now. especially as it relates to methadone. So if we were able to increase our access to these life-saving medications that Dr. Friedmann just spoke of, that would be a real boost to our life-saving efforts.
And Jennifer, tell us a little bit about your experience in Berkshire County and what this grant will mean, to your community.
This grant will have a great impact on Berkshire County. I work in all 32 communities in Berkshire County, and spanning much like we mirror each other quite a bit. We're rural areas, very challenged by transportation and lack of access to services. I too work in an area about of 1,000 square miles, and the two towns indicated for this study, Pittsfield and North Adams, actually the only two cities in Berkshire County, have probably been the most severely impacted by opioid use disorder and overdose deaths. And I think that the entire county, though, as we see Massachusetts slightly dip in its overdose deaths, we're not seeing those same results in a rural area. And I would think that our large treatment deserts as well, our lack of access to methadone, Suboxone, all forms of treatment, as well as access to care, just the number of bodies doing the work in Berkshire County really have impacted our overdose numbers. So a study like this, even being within a control group, I think will only lift up the entire county. And, even though it's just Pittsfield and North Adams, probably because that's where we have our largest populations and our most overdose deaths, many people seek treatment and care in those regions. And so I think that this will have not just an impact for those two areas, in reducing overdoses and overdose deaths, but it will also lift up the entire region. And so I look very forward to this study, and also the study organizers' commitment to having a certain level of involvement in the community after the time that the grant ended. That is so important, and I think a really unique factor of this study is their level of commitment to continue to interact with us and support us and do this work.
Dr. Friedmann, over the last several years, and I know you have all been involved in this, there's been so much an effort put forth, to reduce deaths, to spread the word, prevention, but fentanyl keeps coming up. Has that increased, would you say, in the last 5 years as far as it being present on the streets? Has that become obviously more of a problem?
Yeah, pretty much all of the street heroin that you purchase now is fentanyl. So it really has become the most prevalent part of the illicit opiate supply. And it's a huge problem because of its potency and the difficulty of sort of figuring out what the right dose is for folks. In Massachusetts, overall, we have seen declines in overdose deaths. Over the last 2 years, about 7%, I think 4% this past year and 3% the previous year. Largely, though, we've not seen a decrease in overdoses, so there are both fatal and non-fatal overdoses. We've seen a decrease in deaths. We've seen a decrease in deaths largely because of the distribution of naloxone to our communities, which is the overdose reversal agent, and that has helped. What we haven't accomplished as well outside of sort of the 128 band is really expanding access to treatment, effective treatment with medication, and that I think is what many of us are hopeful is going to come out of this project.